Hello, everyone. My name is Otis Nelson. I'm our Vice President of Sales and Business Development here at Lasso MD. And today I have the pleasure of speaking with Dr. Howard Glazer. And he's a good friend of mine. He's been in dentistry for a long time. Howard, would you mind telling everybody a little bit about yourself, how long you've been in dentistry, and why you got into dentistry and what you love about it?
Sure. First of all, thank you, Otis, for allowing me to chat with you today, and I appreciate the invitation. I'm Howard Glazer. I'm a real live practicing dentist in Fort Lee, New Jersey, and I've been doing this just about 47 years now. And I got into dentistry because I had a great mentor. My dad was a dentist, one of several great mentors, but my dad principally. He was a dentist and a great mentor, and I had the pleasure, privilege, and delightful chance to practice with him for almost 14 years. I actually worked myself up from cleaning that office to owning the office and having my father work for me for a little while, which is quite an interesting thing also. And just like you, I'm in the executive suite in my practice, and I'm the guy that closes the lights when I leave.
I love it. I love it. I love it. I love it. And I appreciate you sharing that with me, Howard. I know that there's probably a lot of viewers out here watching that will definitely, that they've had a similar experience of maybe having a father as a dentist or a mother as a dentist and getting into it. And I happen to know that Howard runs a very concierge practice. He says that all the time, that it's as concierge as it can possibly get. And having that said, being a concierge practice, being a fee-for-service practice that I know that you are, Howard, could you please tell me why you think marketing is important, or what importance marketing has for a dental practice?
Well, the last thing you want to be is the best kept secret in town. And while I like to be somewhat selective in my patient population, and my patient is pretty selective in choosing me to be their dentist and come to our office, we create a very family atmosphere. So it's very important to use marketing to get the word out, not just, the whole thing is you don't want a satisfied patient to leave your office. You want an enthused patient to leave your office. When they're enthused, they'll talk about you. When they're satisfied, they go home and they don't tell anybody. So we've got to do some of that telling. There's an old adage that says sometimes you got to blow your own horn because you're the only one that knows the tune. And that's very true, because for us to appeal to the clientele or the patient population we want, we've got to be unique, we've got to be different, and we've got to be conscientious about getting our message out to the patients so that they know.
I couldn't agree with you more. And Howard, I'm going to throw a little bit of a curveball at you here with that as well. So in the past, historically, I think a lot of dentists feel that, referral based, getting a lot of referrals is just the way to go, and they don't need to spend money on marketing. And I do believe that referrals are very important, and a bunch of dentistry and a bunch of new patients for dentists will come from referrals. However, when do you think the shift was made to where a dentist really need to focus on spending marketing dollars, like that, the importance of really getting out there, telling the story, versus just being the dentist down the street?
So that's a great question, Otis, because I'm the perfect guy who didn't believe in that. Okay, I mean, I didn't even have a website until probably 8 years ago, 8, 9 years ago, maybe. And I saw recently, not only with Lasso, but even the one I had prior to that, it generated patients for me. So I always felt that, I had a good reputation, the word will get out. I relied very heavily on word of mouth marketing. And I was wrong. I think where I was wrong and where the shift came, let me answer it backwards. You said, when should you start thinking about changing that shift? And my answer would be day one, when you start your practice. You budget for everything from architectural design to accounting to legal representation to ordering your signs, getting your telephones, and right up there with all of that should be a budget for marketing. And that budget for marketing is to do just that, get the word out. You're not going to have a guy out in front of your office with a sandwich board, or you're not going to have a guy out in front of your office, twirling the sign, come here. And if you're doing, regardless of what type of dentistry you're doing, I think you need to get the word out from the start that you're here, you're ready, you're available. If you have unique hooks, if you will, such as you speak a different language, you have multiple languages represented in your office, as we do Spanish, for example. I think people need to know that. If you have evening hours and just not a traditional 9 to 5 practice, because we are a service industry, you've got to be available on a weekend. You've got to be available in an evening, perhaps. Start earlier in the morning. Adjust your hours to meet the needs of the population. If you offer particular types of services, how are they going to know that? I've had patients, the most frustrating thing, and probably one of the things that led me to doing a website initially, is I had a patient that came in and said, and been my patient for a while, and said, I had my teeth whitened. What do you think? And what I thought was, why did you go to somebody else to do the whitening? We do that in the office here. But we never told them. So even in an office that was concierge type, as you said, we need to do a better job of marketing internally as well. But back to your question, I think it's so important to market externally in a classy, positive way and an educational way. But if you give them a reason to spend more than 20 seconds as they're looking at your website, remember, most people in my mind are going to search in their general vicinity. And so I think you've got 20 to 30 seconds to hook them on the website. That first page, it's got to be attractive, it's got to be meaningful, it's got to be enough to entice them to go further. It's the same thing when we pick up the phone in the office. If we're not warm and friendly and exciting on the phone, hey, I'm so glad that you called. How can we help you today? If that doesn't come through, you're going to move on and call the next guy. I'm not the first guy in the alphabet. I'm a G. Even if you go with the family practice smiles that we have, you're not going to find us right in the top of the list. So we've got to be a little bit more outstanding.
Oh, I love it. And I couldn't agree more. I appreciate you spending the time with me today, Howard. And I look forward to other episodes in the future, and look forward to seeing you on your speaking circuit sometime soon.
Stay healthy, Otis. Regards to the family.